Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine Show. I'm excited today. We're going to be talking with Dr. Karim about neuropathy. As we all know, neuropathy is a big thing that's going on with a lot of people, and people are wondering how to not only get rid of it, but how they can get out of pain. So today, I just want to say thank you for showing up, and Dr. Karim's going to be available after we're done with the video. If anybody has any questions just on the stream, what I'd like you all to do is, you can instant message him privately. You can put something on the thread, and we can get back with you as soon as possible. But before I do that, I just want to say thank you, Dr. Karim, for coming on the show.
Oh, thanks for having me, Mark. It's a pleasure.
Awesome stuff. So what I'm going to do, guys, is I'm going to brag about Dr. Karim a little bit, so you kind of know not only what he does, but who he is. And of course, I'm going to read a fun little bio. He gave me like 10 pages worth, so I'm just going to go off one. I'm just playing. So Dr. Karim is originally from Coralville, Iowa. He has a bachelor's degree from the University of Iowa. He went to Palmer College of Chiropractic in Davenport, Iowa. Also, he was nominated for the Clinical Excellence Award for his mastery of several chiropractic techniques. He graduated receiving his doctorate in chiropractic and shortly after opened his own practice in the North Liberty, Iowa. He takes pride in being a board certified in chronic intractable pain and neuropathy from the American College of Physical Medicine. Dr. Karim strongly believes in overall health and the body's ability to heal without the introduction of pharmaceuticals. So again, welcome, doctor. And today we're going to talk about neuropathy. So the big question is, what is neuropathy? Because there's a big perception on different things that neuropathies, I got foot pain, or neuropathy, I've got, heart, chest pain, whatever it is, continually. So what is neuropathy?
Well, Mark, just simply neuropathy, to simplify it, it's just nerve damage or nerve irritation, or sometimes it's nerve inflammation. So it really depends on what stage you're at. But it's basically, it's a disorder of what we call the peripheral nerves. To simplify what peripheral nerves are basically the nerves that go down your arms, your hands, or your legs, your feet. So it's away from the central nervous system. So anything down your hands, arms, feet, legs, anything like that. Where, some of the symptoms that we're talking about are kind of like numbness, tingling, pins and needles, burning sensation, sharp electrical sensation. Sometimes people say, hey, I've got cold feet or cold hands. That's sometimes associated with neuropathy. Sometimes it's balance issues. A lot of times, I would say 90% of the time, if it's a balance issue, it's probably neuropathy because nerves are not firing anymore, so you're not feeling where you're walking, what you're touching. So kind of like that sensation as well. Heavy feeling. Sometimes my patients will say, hey, I have difficulty going to sleep, or it'll wake me up from sleeping. Or, a restless leg syndrome, which is kind of type of neuropathy where it's waking them up at night because their legs are shaking, or the spouses will see that basically. Sometimes they'll say rubber band feeling, but there's many more symptoms.
Okay. So basically neuropathy, from what I'm hearing you say, has to do with blood flow not flowing correctly. That's how we're getting that certain type of pain in our body. Is that correct?
So it's kind of associated with, blood flow. So basically what happens is blood circulation is limited now to that damaged nerve because the heart kind of shuts it off. The heart is now sending it to other areas like your organs, which is more important than your nerves, which is further away from your body. So typically what I see in my clinic is neuropathy will typically start in the feet first, and then the hands, because the feet are the furthest away from your heart. So basically what I'll do is shut off some of that blood supply. If you're not getting fresh blood to that nerve that's getting damaged, it's not going to heal.
Okay. Okay, that makes sense. The next biggest questions that a lot of people are asking, I got a list of questions that people are asking about neuropathy. One was, how did I get neuropathy to even begin with?
So neuropathy, there's, they say a third of it could be from diabetes. So the diabetic neuropathy counts for a third. Right now, they say there's about 24 million people diagnosed with neuropathy. Okay, a third of that is diabetic neuropathy. A third of that is idiopathic, which just means unknown. We don't know why. And then a third of the cases are some of the known, kind of like fibromyalgia is a type of neuropathy. So if you don't know what fibromyalgia means, it's basically nerve pain that's everywhere. It could be in your hands, your head, your body. Also, another type is restless leg syndrome, is a neuropathy, or a chemo-induced neuropathy, where you've got cancer, you go get chemo. A lot of times they'll tell you you might get neuropathy from it. Well, those are all cases that we work with, that we heal, basically.
Okay, what's interesting is that I know that a lot of doctors tell patients that they can't do anything about it. Why is that?
So, medical doctors, it's just going through school. That's what they're taught is, hey, give them medications. If medications don't work, then maybe surgeries, then, stuff like that. But here we don't give the medication. So what tends to happen is this. So say, Mark, you have neuropathy, you go see your regular physician. They say, all right, Mark, here you go, take some of the most common ones are kind of like gabapentin. Take some gabapentin or some Balta or Lyrica or anything like that. I start you with a low dosage, right? Then you go a few months and you go back, you're like, hey, doc, this doesn't seem to help. So then what do? They up that dosage a little bit more. So instead of taking now 300 milligrams, now maybe you're taking 600 milligrams.
Right.
Same cycle keeps going. Well, it's not getting any better. Okay, let's up the dosage until they get to a point where they maxed on that dosage. They go, okay, well, let's look at other medication. Well, that medication doesn't work after a while. Because anytime you take medication more than 10 days, and it says it on any bottle, if you buy even Advil from the store, it says if you take it more than 10 days, you should consult with your doctor, because basically you shouldn't take medication more than 10 days because there's going to be a side effect of some sort. And also all these medications always will have some kind of, side effect. So you might be fixing one, but you're always going to create another one. So then eventually what happens is the doctor goes, well, you know what? I don't know what to do. They might refer you to a few other people, and they go, you just have to live with it. Just stay with the medication, live with it. But that's really not the case here in our clinic. And then the worst case scenario is what happens is with neuropathy, and especially those medications that I mentioned, the gabapentin, some Balta, Lyrica, they're not meant for pain. What they do is they decrease the activity in the nerves even more, and that's why they're not feeling that pain anymore, but it's actually killing that nerve over time. So what happens is, say you start walking barefoot and you cut your foot on the, just walking around on something sharp, you don't know you cut it. Well, guess what? It gets infected, doesn't heal, and that's where amputations come in. So that's where they'll have to do the surgery, cut your foot, your arm, or anything like that. And that's the most common thing towards the end.
Would you say, out of your clinic, would you say 20% of the people you deal with in your clinic is probably neuropathy, 30%? What number would you say?
Are you talking about like as a whole in my clinic?
As a whole in your clinic, what would you?
So I have lots of programs here in my clinic, and one of them is neuropathy. I would say neuropathy is probably 50% of my clinic. Yeah, we see quite a bit of neuropathy patients, and it's part because the patients do see the results. We actually have lots of patients that travel from different states. I'm based in the heart of Iowa, and I've got people that are coming from Illinois, Nebraska, Minnesota, Kansas, and they're putting the hours in to come in. I mean, 3 hours, 4 hours just to come and see me. And also, what's nice is we're getting medical doctors, neurologists, neurosurgeons that are referring their neuropathy patients that they don't know what to do with. They're referring them to us because we are doing, good to these neuropathy patients.
Okay. So, and by the way, everyone, don't take our word for it. Dr. Karim has some unbelievable testimonials on YouTube, Google. He's everywhere. After this video, after this live show, what we're going to do is we're going to have live testimonials at the end so you can see for yourself, which is the best business card in the world. Hearing from people how he's actually helped change their lives pretty drastically. Now, one more big question I get from a lot of people is, how can you help me, and what are the treatments for neuropathy? What are your treatments for neuropathy?
So that really all depends on the patient, how severe their case is. I'll tell you how a typical patient, what we do. So typically what we do is someone that, hey doc, I've got neuropathy, I would say, once you come plug into our free seminar, basically bring your loved one because it's a lot of information. So they come in the seminar, it tells them everything about neuropathy, the symptoms, what we do for it, how we can help them basically. Once they're done with the seminar, if they're interested in pursuing more, then the next step is doing our exam. Our exam isn't a typical exam. It's not where, they sit in the room for an hour and then the doctor comes in for 5 minutes and talk to them and then send them out with a script. No, this is actually, it's all flipped around. So you're going to come in. We're actually going to probably spend about an hour and a half with you. Just want to know everything. We want to know when it started, all your symptoms, what you've done for it, what has helped, what hasn't helped. And then once we're done with the consult, then that's where we'll do the exam. The exam that I do, it's all hands-on. It's not a machine that I plug onto you and tell you, oh, the computer spit out and say you have neuropathy. No, it's all hands-on. It's actually you telling me what you feel, okay? So we're doing sharp sensation, light sensation, cold, heat, vibration, so multiple tests to see those nerves are damaged. And then what that tells me is how much nerve damage that you've got, how much sensations that you've lost. And from there is where I create a plan for you. So everybody has a specific plan, a different plan. Not everybody is the same. So that plan, when I create it, I actually look at you as a whole, inside out. So I'm not concentrating on your feet or hands if that's what you're complaining about. I'm actually looking at your whole system. Because a lot of times also that we find out is it's really a gut issue, because your gut is kind of like your second brain, okay? That's where inflammation comes from. That's where a lot of diseases come from. So if we're taking care of your neuropathy but not taking care of you internally and say you've got a gut issue, then it's not going to heal as quick as we should, because we want to decrease inflammation. We want to increase the circulation in your body. We want to basically rehab that nerve to fire back up the same rate that it should be. So basically the treatments that we're doing, it's increasing blood supply to your nerves. It's also repairing and re-educating the nerve, increasing balance, mobility, decreasing some symptoms, so you get better sleep, all that. But yeah, I mean, that's typically what we do. And then treatments, that really all depends. Depends, like I said, how severe. So some of it could be, I mean, a severe case will be, they have in-home treatments, which include light therapy and nerve stimulation that they do every day. And it could be twice a day, 3 times a day, depends on their condition. So that's one. And that's really counts for about 80% of their treatment that they do at the comfort of their home. And that's why I have a lot of people that travel from different states, because then they can do it at home and come see me once in a while to see how they're doing. The other part is doing it in the clinic, which we do oxygen therapy. Basically, what it does is it increases oxygen levels in their cells, so it starts to heal. We do vibration therapy, we do laser, we do traction. So we do lots of things for the patient that helps stimulate that nerve, increase circulation, and help heal and detox their body basically at the same time as well.
Okay, wow. So it's really, I know a lot of people ask how long will it take before they feel better. Just like you said, it just depends on if they're worst case scenario or if they're, it's depending on what level they're at, I guess what you're saying.
Yeah, so how long it takes, I really say, we give you the tools, and then it's up to your body and God.
Right.
It really is. It's up to your body. Depends on how long you've had it for. Is it more that you've had it 10, 15, 20 years, or you've only had it for 2 years? Obviously the less time, the faster it will be. To give you an example, I mean, the youngest patient I've seen with neuropathy was a 14-year-old. That took about 6 months to heal.
Wow.
So nerves really depends on where it's at and how long you've had it for. It can take anywhere from 3 months to 2 or 3 years.
So I noticed that you said it basically, this starts in your gut. Is that correct? Normally?
So the gut is inflammation. So inflammation really comes a lot from the gut.
Okay.
Also like diseases. So if you're not eating right and have you heard of leaky gut syndrome?
Yes.
Yeah. So that's basically the gut is leaking toxins because that's the waste area that's going through there, and it's leaking toxins, and that's causing inflammation in your body. And that's why like some people might have like Crohn's disease or anything like that. That's stuff that we can take care of and take them off their medication just by doing that system. The system that we have is basically, I always say it's kind of like a burning house, right? Your gut is kind of like a burning house, have all that inflammation. So what we need to do is put out that fire, okay, down the building, reseal the concrete, and start building again. So that with our program, that's what we're doing. And that's why people will start to lose weight if they're unable to lose weight. That's why you'll see a lot of people go, hey, doc, I've tried all these diets and, I might lose a little bit, but when I get off of it, I gain it again. And that's usually because it's a gut issue. Stuff that their body's allergic to that we need to eliminate. And that's how we do it. It's kind of like an elimination diet where it's like you got to eliminate all that. And then on day 25, you're going to start to introduce each one separate. See, do you have a reaction from it or not? If you do, then you're allergic to it and you shouldn't be doing it really. And
so basically a lot of this is with the foods that we're eating. I think I mean, correct me if I'm wrong, but I'm just trying to processing all this. So, I know that my family, we have a lot of islanders that were born on, Guam. So they basically have kept their regimen of how they've eaten their entire lives. And what I've noticed is that when they get a little bit older, they love salt. Mm-hmm. And they love pork. But I noticed that everything's really, they haven't changed their diet. And now I'm seeing a lot of them starting to get diabetes. So I think that if we don't change as we get older with our diet, this has a lot to do with catching these symptoms of neuropathy. Would that be kind of close to correct?
That's correct. And actually with our gut health program, we actually have changed a lot of the diabetes type 2. If they're diabetic type 2 and they actually follow our program all the way through and they change how they eat and stuff, they actually reverse that and they're not diabetic anymore. So yeah, really, Aristotle did say, if you read his quotes, that the true medicine is food. So if you eat right, that will change how your body reacts to everything.
Wouldn't you say that our food has changed a lot? So it's really hard to, you buy something in the store and you think it's healthy. And so it's a little bit harder nowadays to even if you're trying to eat healthy and you think you are, I'm just saying with all these pesticides and stuff they're putting on our foods.
True. Yeah, it's true. I mean, nowadays it's a lot harder because what they're trying to do at supermarkets is to keep that food, staying on the shelf longer. So to keep it living longer, you have to spray it with chemicals, which any chemicals that you put in your body is toxic, So yeah, I mean, the biggest thing that we try and have people eliminate is like processed foods. And we kind of tell them, hey, read the labels because everything has sugar and sugar really isn't good for you. I mean, the biggest thing that feeds cancer is sugar. If you actually look at some of the holistic cancer centers, the biggest thing that they do when they first go in is eliminate sugar and carbs because carbs turn into sugar. Mm-hmm. That actually decreases the cancer cell because it's basically what feeds cancer is sugar. So you eliminate that, you're going to start to kill that cancer cell really.
Yeah, it's funny you say that because like now when I mean, trust me, I love to have a good burger with a bun, okay? Mm-hmm. But I'm starting to get my body more used to not having the bun and just having the meat with the vegetables. And, it's so much harder because we're raised a certain way.
Yeah. Just tell them, hey, I want, instead of a bun, just wrap it with lettuce.
Yeah, I'll just make sure that lettuce tastes like bread. But anyways, so on your seminars that you're having, about how many seminars are you having a month, an average for
So I actually have 2 seminars a week.
Oh,
I have them every Tuesday and Thursday at 1 o'clock. And, you know, we're trying to help as many people as we can. So that's why we have them as often. Now, if someone can't do that, then yeah, we'll do a specific one for them when it works. But yeah, we do 2 seminars a week.
Okay, awesome. Okay, well, I just want to say thank you so much for being on the show and having you. Everybody, I need you to share this. There's always somebody in pain with neuropathy. Like myself, I have a family member who is actually being healed from neuropathy, so I'm excited about that. So we want to get the word out. And if there's people, you know, in the Iowa area, get the word out. Sharing is caring. Put this on your page. You don't know who you're going to help. And one thing I love about Dr. Karim, getting to know him, is that he's really focused on helping the person get to new health and not just telling them, hey, you need to do this and that. He finds out everything about that person. If you have neuropathy in your knee, he's not going to just go right to the knee. He's going to go check everything out on your body to make sure that you're doing good and to find out where the pain really is. Just because you have the pain in your knee or your foot doesn't necessarily mean it's there. So everybody, please share this. And again, I want to say thank you so much, Dr. Karim, for being on the show. And we're going to have testimonials right after this video. And make sure you get a hold of Dr. Karim and call his office. The phone number will be on the screen. Matter of fact, it's on the screen right now. Thank you, Dr. Karim, and thank you, everyone. God bless.
Thank you, Mark.